Greetings to our friends in Pakistan and Sister Miriam in the convent in Athens, Greece. It's nice to know that you tune in on us from time to time. Today we're going to talk and start the article that changed everything. It was called A Fibromyalgia, a Den of Demons, New Discoveries Upon New Discoveries. It was published in the American Chiropractor in 1999. And it's a spotlight that was thrown in by our having time to investigate this condition called fibromyalgia. Fibromyalgia, as we have shown you so far, the best and most well-financed doctors in the world don't even have a clue about what's going on in this condition. And they're spending your money by the buckets and giving you no satisfactory answers. There's also a spiritual component to this condition, I believe. It is so neat because they could spend billions of dollars of your money proving what you don't have, and they can't find out what you have. That's demonic, and that's why we included this demonic den of demons. Real demons are involved here. If you know your Bible, you know that for everything that's happening on the earth with us, there's a spiritual counter battle going on in heaven. And an example of that was when Daniel's angel was held up for so many days. So we'd like you to know that we are Christians here. We are God-fearing. We do our work because we believe that God has empowered us. I personally believe in Jesus Christ, and I have accepted his redemption. And we continue this quest beyond ordinary income, power, prestige, or any other reason, but getting people well, because there are so many hopeless people out there, you cannot believe it. The article starts, the title, Fibromyalgia, a Den of Demons, New Discoveries Upon New Discoveries. The word den we decided to explain because a lot of people don't know exactly the definition, and I didn't either. The lair of a wild and predatory animal. 2, a hollow cavern used especially as a hideout. And a center of secret activity. Merriam-Webster. Introduction. At the end of my 45 years of practice as a holistic chiropractic physician, there appeared from time to time, and with increasing frequency, a diagnosis of fibromyalgia, usually made by a rheumatologist or a physiatrist. Except for the fact that these were usually bad cases, I filed them under the heading of advanced myofascial fibrositis, and smiled to myself that the doctors who were unaware of the trigger points that had been part of our stock and trade for all of those years were getting serious about these abnormalities. In retirement, people who learned what my vocation had been, many sought my opinion. My stipulation for consultations were that no doctor available was helping them and that I would take a look. It was in this vein that we encountered a person from a fibromyalgia support group. This is where we began, and we had, of course, unlimited time to examine these people and began to make breathtaking discoveries, many of which were based on previous discoveries, which I had been reporting for the past 20 years. This article is basically in 3 main sections. 1, what is known and or suspected about the condition. 2, the discoveries that I have made about the condition. And 3, the treatment and outstanding success of the treatment. I am aware that many traditional doctors will be upset and nonplussed by what we present here. For this condition, more than any other, illustrates the fact that chiropractic in particular has repeatedly ignored the advances made by others. The best of today's graduates from the best schools are, in my opinion, not qualified to either diagnose or treat this condition. This is because the basics of the diagnosis are not taught in any college that is known to me. In answer to your unspoken question, I write and divulge these things so that people can be better and maintain healthy, productive lives. Knowing that only 2% of the doctors will understand, and the 2% are ready. When the student is ready, the master appears. Fibromyalgia, what is known? Fibromyalgia is considered by some as a syndrome or collection of syndromes, and by others as a disease entity. The doctors of the world are getting serious about this condition and now have meetings around the world, such as the Copenhagen Fibromyalgia Symposium. The outstanding symptoms are pain in muscles and joints and stiffness. It is generally accepted that this must be whole body pain, with representatives on both sides and above and below the waist. The list of symptoms is impressive and diversified. Some doctors now include what is called the Fibro 5, which are chronic fatigue syndrome, depression, irritable bowel, interstitial cystitis, and migraine headache. Some include sleep disorders. In most severe cases, the victims are not able to maintain employment. The symptoms are varied and widespread. Musculoskeletal pain and aching, disturbed sleep patterns, fatigue, paresthesia, depression, soft tissue swelling, irritable bowel, TMJ and bruxism, bursitis, allergies, sciatica, chest pains, back pain, interstitial cystitis, migraine headaches, Raynaud's, dysmenorrhea, hypoglycemia. You can add to that vulvodynia and lupus and the other immune disorders. It is usually differentiated from arthritis, both rheumatoid and osteo, polymyalgia rheumatica, myopathy, hypothyroidism, disc herniation, cardiac or pleural pain. Despite the symptoms, physical, laboratory, and radiological studies are often normal. The connective tissue disorder is not associated with deformity of the joints. Diagnosis has been seen as clinical. In tender points or trigger point diagnosis, they have 12 to 18 points, and we'll show you here on the graph where they are. And they are at the knee, the greater trochanter, the gluteus maximus, the lateral epicondyle, the second rib, supraspinatus origins, trapezius, midpoint upper border, lower cervical, anterior intertransverse spaces of C5 to C7, occipital and suboccipital insertion. When they press on these points, they must be regarded as painful versus pressure. The concept of central sensitization. While many theories have been advanced, such as hormonal, neurotransmitters, etc., astute observers have accurately described the concept of central sensitization, describing the decreased threshold of pain in these subjects, hyperalgesia. Some people believe that decreased blood to the muscles activates chemicals or irritates their release, accounting for the irritability. One theory is that this is a disease of the central nervous system, not a pathological change, but a central activation versus a type of myopathy. Remember this very astute observation, for we will explain why it is correct, even though the proponents do not understand the mechanisms. Current medical treatments are palliative and concentrate on the usual pain relievers, such as aspirin, acetaminophen, and other NSAIDs. If the pain is not relieved at this level, stronger prescriptions are read. Alternative medicine has many interesting remedies and theories, but none of these hit home runs. Chiropractic in general disgraces itself in the treatment of this condition, because the practitioner, invariably being a strictly mechanical chiropractor, increases the frequency of treatments to daily as desperation sets in and the patient slips away from him because he does not hold and is getting more and more inflamed. I know this for a fact because I have web pages for this condition and consult with victims around the world. These events are usually present in their history. We'll continue with this article because it is absolutely a beacon in the darkness, and we want everybody to understand it. Thank you.